name's Ashley, and I'm a shoe saleswoman, and I'm a dancer, and I go to school full-time. I have a bunion, and it's been hurting. I'm in a dance company, and we do a lot of traveling and dancing intensely, and it's been getting worse and worse, so I figured to take care of the situation before we start traveling again next year.
Ashley is about to have a bunion surgery. Bunion surgery, it's the deformity of the angles of the bone. What happens, one of the bone moves to the other side. As a result of that, the patient feels the deformity on the side. Usually they notice the deformity and the pain with a cold shoot or physical activity. I could pretty much explain to you on this diagram what happens is one of the bone, rather than being straight, it moves to the other side, and that's what we see here. Ashley's x-rays, we could see here that the bone, they are not parallel to each other. We could see this bone has already moved to this side. So we could see the high IM angle here she has here. And the pain that she has is right around here. We're gonna move the bone over in where it's supposed to be. If I may show them this x-rays, we see the dotted line is, that's what we're gonna do. We're gonna move the bone over. And what we're gonna see is the bone is gonna look like this. This is the after the surgery. That's how it's gonna look like. Now after we move it, we move the bone in the where it's supposed to see it. What we're gonna do is to make sure that the bone stays there and it doesn't move, and we have a healing process. What we do is we usually use a screw. The screw, the main purpose of the screw is to keep the bone, keep the two fragments together. When they have a compression, they're gonna heal faster. Probably what's going to happen in Ashley, we will see her back in her activities within 2 or 3 weeks. I put the patient in the range of motion 1 week after the surgery, and the patient go back to her regular shoes in 2 or 3 weeks. Obviously, every patient is different. Every expectation we have different from every patient, but that's what we usually see.
Process, I lost my contacts, so it's good. Cool. Okay. And they fed me pizza, so it's good. It's been 3 weeks, and probably like the week after the surgery, I was back to my normal routine of working and dance practice, but taking it easy. My foot's been good. It was just a healing process and trying to adjust to my foot and everything. It was hard, but I'm back to normal now, so it's good.
You can see how much of the bone we already have moved over, and you can see the alignment. This is the screw that we have placed in there to maintain the alignment. There is a great compression of the screw, there is no gapping, and I like the position of the sesamoid. The sesamoid, you could see, is right under the metatarsals, and the toe is a very nice alignment.
I feel the difference, like when I wear shoes, it's actually much more comfortable. Working, being on my feet all the time over at my job is it's much easier. It's still a little swollen, so I'm not to 100%, but it's much better than it was before. It's easier, less pressure and everything. So.
These are the x-rays were taken before the surgery. And these are the x-rays was taken today. This is the x-rays from the lateral view, which is very nice. Pretty much what we have done during the surgery, as you can see, there's a deviation of the metatarsal here. We moved the bone over, we moved the capital fragment over, and then when we reached the ideal position, we put a screw in there to maintain the alignment.
I'm gonna get my other foot done too, so I can get it before my big debut in Lebanon for dancing.